Welcome to this course on learning disability, and you'll cover skills deficit model. What is a learning disability? It's when the development of communication skills and acquiring knowledge is impaired. So this can impact lots of different aspects of a person's life. So we generally think of learning disability as cognitive ability, so that gets referred to as intellectual disability. And there's a range between that. So on an IQ test, from 70 and below is where we'll talk about intellectual disability. But generally, when we say learning disability, we just mean intellectual disability. However, there are a lot of other learning disabilities, things to do with speech and language problems, so communication disorders. This includes reading, maths, and written problems. So things like dyslexia falls within this category. And then there's motor skills disorders, so coordination problems and coordination disorders. And again, lots of different communication disorders. So it can be things like stuttering, it can be phonological disorders, expressive language, it can be like any other language problem as well. So learning disability is quite a broad range, but we're going to mainly focus on intellectual disabilities on this course. So we'll go through the different ranges from mild, moderate to severe learning intellectual disability. With learning disabilities, there are a lot of comorbid problems. So this is when there's more than one problem. And one thing just to keep in mind is that sometimes we can have another problem or disorder that might seem like it's more prominent, especially if they've got mild learning disability or mild intellectual disability. So I'll go through some of the main ones so that you can be mindful of other types of problems or diagnosis that can go with it. So some of them are sleeping problems, toileting problems, food and eating disorders. There's genetic syndromes, autism, relationship and sexual difficulties, living and working in the community. There can be self-harm difficulties. And so there's lots of different things that can present with intellectual disabilities and can be comorbid as either a diagnosis or other difficulties that can be prominent.